back. A lot of people plan to travel this summer, especially with 4th of July being next week. But if you're planning to fly, you might need to wear some compression socks. Joining me this morning to talk about why wearing this is crucial is vascular surgeon with Houston Methodist, Dr. Linda Lay. Thank you so much for coming in, Dr. Lay.
Thank you for having me, Haley.
So we have heard this before that you should wear compression socks on flights, but I mean, is it really necessary? Does it really do anything?
Well, so if you are normally active, young, and with no risk factors, no, it really doesn't. It doesn't hurt. I actually wear compression hose every day at work because it just makes my legs feel better at the end of the day. But no, it's for your comfort, unless I would say if you are a high risk patient, like you've had a previous DVT, you're older, you smoke, you might be more immobile than normally, then wearing compression hose on long flights may help. Because
what it's doing is helping to prevent blood clots, right?
Correct. It stimulates your calf muscles working and moving, and so it gets the blood flow back to the heart so that you're less at risk for a DVT.
And I mean, I actually wear them because I feel like it, prevents swelling. Just, like when you're on a long flight, your ankles get swollen.
Correct. Yes, as do mine. So yeah, I wear them on flights just for my comfort. Other things you can do to help are just walk around every couple of hours and make sure you stay well hydrated. A lot of people don't drink a lot when they're on flights because I don't want to get up and go to the bathroom. Right. Yes. Yeah. So, but it is important to stay hydrated. Walk after a few hours on a flight, and just stay as active as you can. You can do some ankle exercises like rolling your ankles and kind of get your feet moving where you're at in your seat to help as well.
And so you say to do that every few hours, get up, stand up, walk around, make sure you're drinking water. But you can have serious health complications if you don't do these things. Can you explain why it really is so necessary to make sure you're doing all of that?
Yeah, so like I said,
because a lot of people are going to say like, well, I'm fine.
Yes, yeah. And like I said, if you are normally, otherwise healthy, you're active, there's no studies that show that you're at increased risk. But if you're an older patient, you've had a prior DVT, you might have had cancer or some sort of trauma, some surgery, those sort of put you at higher risk if you're going to fly for a DVT. And then, the worrisome part of a DVT is that it could go to your lungs and cause a pulmonary embolism.
I remember when I was pregnant and I was flying, I was told to wear compression socks, but I think that's a recommendation for a lot of the duration of pregnancy, right?
Right, and with pregnancy comes hormonal changes, so a lot of times increase in hormones are also shown to have an increased risk for DVT, but very, very small risk.
But the compression socks can be pretty cheap too. Like, does it matter if you buy the cheaper kind that you can just get at the drugstore or something?
So it's based on, the medical grade compression hose are based on millimeters of mercury. So the higher the number, the tighter they are. I always tell my patients, if you are not sweating and struggling to get them on, then they're not as tight.
Really?
Yes, yeah. So now that's medical grade. If you're wearing them for comfort, then you pick what kind you want. As long as they feel snug, then that's good. But if a doctor tells you to wear your compression hose at a certain degree of millimeters of mercury, then that's the number you need to wear.
They should actually be really hard to get on.
Yes, yes, yeah. And if they get loose, that means that you need to get a new pair.
I did not know that. Yeah. Interesting. All right, Dr. Lay, anything else that you'd like to say, especially when it comes to traveling this summer?
No, just like we said, stay hydrated, move around. If it's a really long flight, get up after a couple of hours. You can do some exercises with your ankle, your legs at where you are sitting, and that should keep your legs healthy.
What about varicose veins? Can you wear compression socks to prevent those?
They help. Definitely. That's actually one of the diseases that I treat. But with varicose veins, that does need a medical grade compression hose. It's usually 20 to 30, and then those will usually help the patients, and then if further procedures are needed, we talk about that in clinic.
So. I'm sure you're going to have a lot of people going out to buy compression socks if they help with varicose veins. Dr. Linda Lay with Houston Methodist, thank you so much for coming in. We appreciate your time this morning.